Hello and welcome to Money Talks. I'm your host, Ed Marshall. New Orleans and the metropolitan area are always listed as some of the best places to visit. And officials' number one concern for our visitors is, of course, safety. Like most larger metropolitan areas, eliminating crime is a top priority. When we come back, we'll tell you about a new effort to help curb crime involving the local clergy. Come on back.
You're watching WLAE, New Orleans Public Television. Find us on Facebook and follow us on Twitter.
Well, welcome back. Churches across the area are joining with New Orleans Crime Stoppers in an effort to get residents to speak out about crime. Here's Crime Stoppers Director Darlene Costanza with more.
Very excited. We're starting a new faith-based initiative that's called Speak Up, Project Good Samaritan. And what we've done is we've gone to the different churches and asked them to help us share the message of Crime Stoppers, the empowerment that speaking up provides for you so that you can be a witness to what you see around you, certainly be a witness to friends and family who may not know what Crime Stoppers does, to let people know that this resource exists for them. So we will be visiting the area churches. We've asked the clergy to present the information about Speak Up. And once a church signs on with our Crime Stoppers Speak Up program, we will ask them to place a sign outside the church that shows that they are a safe place, a safe haven for people to understand and use the Crime Stoppers program. The second part of that is Project Good Samaritan. And what we're working to do is to develop a resource directory or a guide for victims' families so that they understand when something happens, the first place they may want to go is to their church and talk to their their clergy or their pastors. And then we're going to have information about where you can go if you need different services. We never know what a family might be faced with. Maybe someone needs to have counseling. Maybe someone needs an aftercare program, parenting skills, food bank. Many different ways to be able to touch someone to help them heal. So the Project Good Samaritan part is being that circle of friends, circle of love and care around the victims' families through the ministry, through the congregation, so that we are being supportive. We are also asking them to join us in proactive events such as Night Out Against Crime. So again, once again, providing that education, providing that place for all of us to come together and share in the message of being safe and being empowered. So that's Project Speak Up, Project Good Samaritan, and you'll see more about this in the months to come.
As Crime Stoppers continues to try to do its part in terms of reducing crime in the New Orleans area, New Orleans Police Chief Michael Harrison is doing what he does, heading up the New Orleans Police Department, talking to people, talking to residents in different parts of the community. He wants to know what's on their minds, and he wants to also hear from them. Recently, the New Orleans Police Department inserted a videotape on its website, and we want you to take a listen to part of that right here on Money Talks.
We're always concerned about safety, so safety is always first. In general, we're going to tell you why we stopped you, but before we can do anything, we all have to be safe. And so when we approach, if we feel that that situation is combative and that person is resistant, before we even begin talking, we're not going to do anything until we establish safety. That's what we train. We're going to tell you why we stopped you, but we have to be safe first. So what you should do is give the officer all of the information that the officer asked for. Your name, your driver's license, your insurance and registration. Answer any questions. Keep your hands where the officer can see them. So we're not going to use force at that moment because we are only authorized to use the level of force necessary to overcome force being used against us or force being used against another citizen.
And for the entire conversation with New Orleans Police Chief Michael Harrison, you can go to the NOPD website.
You're watching WLAE, New Orleans Public Television. Find us on Facebook and follow us on Twitter.
Hurricane Katrina left a mark on the metropolitan area. The storm left some 80,000 residents in New Orleans East without a hospital in close proximity. That changed in 2014 with the opening of the New Orleans East Hospital. Well, that hospital now has a new CEO. We spoke with Dr. Takesha Davis about her role and the new hospital.
As of April 1st, we are happy to announce that we're in network with all of the major insurers. Now, the second thing is, as of April 1st, we've expanded a lot of services. So we added orthopedics to our service lines. It's important because we have lots of residents, upwards of 80,000 in New Orleans East, and sometimes we do fall and bruise and break things, and so now we can take care of them close to home, and that's really our mission at New Orleans East Hospital, to provide quality care close to home. So smartly, our mayor decided, well, I can build a hospital and I can manage a lot of things. Healthcare is not my expertise, but I do have a lot of partners in the city who can. So LCMC Health partnered with the Hospital Service District A and the City of New Orleans to run New Orleans East Hospital. And LCMC Health System is this health system that operates not just New Orleans East, but Touro Infirmary, Children's Medical Center, the UMC Academic Center, and West Jeff. So we belong to a system. And I've seen that this hospital, as it came back online, not only provided an opportunity for acute health care, but also educational empowerment for the community about how they can be well. And so we pride ourselves on providing not just sick care, but well care to our community, and also economic empowerment. Where there is good health care, it stabilizes communities. And New Orleans East Hospital has done that for New Orleans East, Gentilly in the lower 9th Ward, by bringing quality health care close to home. We've seen other physician offices to open up around the hospital, as well as durable medical equipment businesses where they sell oxygen, pharmaceuticals companies, and that's what you're going to see when a hospital comes back into a community, that not only do you provide health care, but you provide jobs as well. So when the hospital opened in June of 2014, we opened with a 24-hour, 7-day-a-week emergency room because we knew acute care services were in dire need, but also general medicine, general surgery, kidney services, stroke care, rehab services. So we have physical therapy, occupational therapy, speech therapy as well. We have cardiac rehab services. We provide mammograms, open access colonoscopies, the things that our community said we need and we want in our community. In addition to that, we've been open nearly 2 years now. And as we've learned from our patients that have come in over the last 2 years, we have additional needs. So I mentioned earlier that we now have orthopedics that started. We're also looking at how do we expand pulmonary or respiratory care at our hospital. And also we opened with cardiology services for those who might suffer from heart diseases or may unfortunately have a heart attack. That's been there since day one, but how do we expand on those services and making sure that individuals have the opportunity to get cardiac rehab and cardiac well care? And so we expand on those services. We know that by bringing services to that community, we're able to impact the health care of our community, not just within our four walls, but outside of those walls, and reaching out and doing activities that involve wellness. Most recently, we had a diabetes wellness event. It was fantastic. We had nutritionists to come out and teach our diabetics how to cook better for their health, what they should eat and what they shouldn't eat to be well. We also had physical activity opportunities for not just our more seasoned adults, but also for kids. That's really important because for diabetics, evidence shows that if you can change your eating habits and you can actually exercise, you might be able to lower your blood sugars to the point where you don't need medications anymore. And so as we talk in our hospital, we want to make sure that we can take care of people where they are. And where many individuals will need hospitalizations, others will need outpatient care and education. So that diabetic event was one that was well received because we were able to provide a lot of education to diabetics for their own self-management. As of July 1st, we will have Medicaid expansion. So what's that mean for everyday people is that 25-year-old who's working hard, probably going to school as well, who doesn't have health care, may not have gone in to get their annual exams, now have a mechanism to pay for it where healthcare isn't debilitating to them and not going to bankrupt them to go in and see their doctor and get their recommended screenings. These are things that our national healthcare agencies like the Centers for Disease Control recommend for all of us that most people don't go and get because their finger is not falling off, right? So I'm not gonna go and spend the money that I might need to have to eat dinner at night. But now with Medicaid expansion, that component is removed, right? So that barrier is removed, and now I can go in and have my blood glucose checked, I can have my blood pressure checked, I can make sure that I don't have any other medical issues that need to be seen by a provider before it gets to the point where I have to come into a hospital. I came into a system that was completely paper-based. And if you can think about it, we had 70 clinics. We were at the time actually privatizing our hospitals. But if you walked into the door of a clinic in Houma, Louisiana, and you had just moved from Baton Rouge, Louisiana, I didn't have your records. I didn't know when you'd had your last mammogram. I didn't know when you had your last physical exam. So I probably had to do those things again, which was uncomfortable to you as a patient, cost you more money, cost our system more money. And then if you went to the hospital 2 days later, and it was a state hospital, they didn't have your records. They didn't know that you saw me 2 days before. So they repeated some of those same tests. And we just created more costs in the system, but most importantly, we did not provide the best service to the people coming to see us, who deserve that. And so electronic health record we put into place at the Department of Health and Hospitals, and it was tough, right, to go from paper, and we had staff who'd been there for 20 plus years. But when we got to the end of that process and really over the hump, we all saw the benefits in quality and standardization. So as I brought that to the hospital, one of our tenets is to make sure that we provide not just the best quality of care, but superior quality of care, because we can't be just as good, but we need to be better.
And a great big welcome to Dr. Davis. Well, when we come back, we'll talk fashion and what you need to know going into the fall wedding season. We'll be right back. Talk show. Our goal each month is to keep you informed on financial issues affecting you and your family. Whether it's concerns about the stock market, mortgages, local community initiatives, or decisions made on Capitol Hill, we do our best to bring you news that you can use. So join me for Money Talks every Wednesday at 1:30 p.m. and 7:30 p.m. right here on WLAE. And we're back. Many couples are preparing to say I do this fall. We talked with a local wordsmith about invitations and wedding planning.
Style of wedding that they really want, the invitation should reflect that. And if you look at any etiquette guide, they may disagree on different things, certain things, but they all agree that the invitation should reflect the event. And so if you're having a casual wedding on a beach or in a park setting or someplace like my niece got married at Audubon Zoo, you're going to have a different style of invitation than if you were getting married in a large cathedral and having a hall, a very formal hall setting for your reception. So the invitations should really reflect the event. And today, there's just so many different choices, different papers, different materials that some of them are not even in paper. We have things on synthetic materials, things with fabrics. There are things with lace is very popular. Different types of paper. Shimmer papers are really popular now. Some invitations have like glitter, so they get a little bit of a bling to them. And some of them are still very traditional and have that vellum finish of a classic wedding invitation that people still like. Well, it's a custom item, a wedding invitation, and there's a lot of choices that have to be made in the process of creating it. Most of the things you buy online are already made. They're something that somebody just has to take off the shelf and package and ship to you. But a wedding invitation is very personal. It's got a lot of, the wording is unique, the type style is something you're going to choose, the ink color to go with the invitation, the card that you pick. All of those choices that go into it are something that it helps to sit down with someone else, someone who's been in the field, someone who knows the business of printing invitations, and work through those questions. And we also will catch you if you make a big blunder like leaving the time off of your invitation. Believe it or not, that does happen. So every once in a while we do get somebody come in who's ordered online and they're practically, well, sometimes they are in tears because they got something that wasn't right, and the answer sometimes comes back, well, that's what you ordered. We don't work that way. We're going to give proofs. You get a chance to see everything, and anyone who's professional is going to do that. A bride or whoever's ordering invitations should order at least 3 months before the wedding. That's the short answer. The reason for that is not because it takes 3 months to produce them, but it does take time to get the proofs done and do the printing, usually a couple weeks. But then you need time for addressing and mailing. And the rule of thumb on that is that locally, invitations should go out 6 weeks before a wedding, and out of town, maybe 8 weeks. Well, that's 2 months. So that just allows you a month to get the production done, about 2 weeks, and then to get the addressing done. So no matter how you do the addressing, it's going to take a little bit of time. So it is important to order on time. So 3 months is what we recommend. And then a lot of people today send out save the dates earlier than that. They'll send them out like 6 to 9 months before the wedding. Well, there are some of us who still have great handwriting, and I'm not one of them. But if you do, I mean, that could be a good way to do it, is to address them yourself, but leave yourself plenty of time, because it does take time. Some people hire a calligrapher to hand address them. And the other way they're done more and more today is to do them on a computer. If you're doing them on computer, we recommend printing direct to the envelope, and we actually offer that service. So you can do it on your own, or you can allow us to do it, and we charge a little bit for it, but I think it's worth it. We'll send an Excel file, and people just fill out the database and send it back to us. And then we merge it in, and we can do any different type style, different ink colors, match the type style of the invitation, or choose something completely different.
We've had several prospective grooms who've written into our show asking us to talk about fashion with fashion experts about menswear, what they wear to a wedding and what they should not wear to a wedding as well. Well, here's the answer.
Definitely it matters where the wedding is going to be. If you're a guest to an outside wedding, I definitely suggest, if it's during the summertime, that you are definitely appropriate with the type of fabric you're going to wear. If it's linen, if it's in the summertime, springtime, you should want to wear like linen or seersucker. And in the wintertime, you want to stick with like wool. I would say for our weddings, pocket squares, you could do like a linen handkerchief, like pocket square. You should own at least one tuxedo. And with that one tuxedo, you could switch it up with the necktie or with a different vest. Tailored definitely means that it fits your body. That don't mean that it's tight on you, and doesn't mean that it's oversized on you. It is something that you could sit down with, move around with, but it's, like I said, it's something that, goes with your body type.
Well, when it comes to the pants, make sure that it sits right at the waist. You don't want to sag. Pants, also when it comes to the break, make sure that it stays right along with your leg length. You don't want it too baggy, or also hanging below the cuffs of your shoes or hanging under it. Make sure that it sits right around the ankle length. Also with the jacket, make sure that it fits right alongside your sides, not too baggy. Also your bust, and you don't want it too tight. You don't want it to bust open as you're buttoning the top button. If you want your shirt to show, which I recommend, have it break roughly half an inch above your wrist so that your shirt can actually show. Well, the main thing, especially for young men when it comes to buying a suit, you don't want to break the bank on buying a suit. I mean, again, I stress that you can literally buy an expensive suit and then get it tailored and it'll look like $1,000. Go with the simple colors. You don't want to go too crazy. Go blue, black, gray suit, especially when it comes to interviewing or jobs. You don't want to go too crazy. When it comes to the ties, it's really on your personality. A lot of people like to wear bow ties now. If you're comfortable wearing a bow tie, definitely go for it. I like wearing them, even though I am wearing a traditional tie, but it's more on personality. Some people aren't comfortable. You want to be comfortable in your suit, so don't go too wild with anything that you're not comfortable with.
And congratulations to all the couples that are getting married this fall. We'll be right back. The music world was recently silenced with the passing of Judy Spellman Briscoe. Judy was a native of Jefferson, Louisiana. Her unmistakable voice took songs like To God Be the Glory and Wind Beneath My Wings to new heights. We send our heartfelt condolence to her mother, her daughter, and the rest of her family. A famous author once said, God sent his singers upon earth with songs of sadness, happiness, and mirth, that they might touch the hearts of men and bring them back to heaven again. Judy Spellman Briscoe did just that. She will be missed.
So who's going to do what?
I'll pack the dead batteries.
Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice. And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
We couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
And welcome back. Well, the Young Leadership Council's Wednesdays at the Square concert series has ended for this season. Despite the rain on many Wednesdays, YLC officials say they're pleased with the outcome.
It was an amazing success this season. Wednesday at the Square is put on and led by an incredible team of volunteers. Matt Truding was the leader of that team this year, and the amount of work that they put in over the course of last fall and throughout the spring to make it a successful event is just so impressive. We had a great lineup and we had a great band close out the season. Tab Benoit did a great job our last Wednesday. And it looks like financially we're still looking at the numbers coming in. It was successful. Wednesday at the Square is one of our largest fundraisers, and it wouldn't be possible without sponsors. Role Model Gala is an opportunity for us to recognize the leaders in the community who have made a significant impact over the course of their career and lives. We pick 25 role models every year, and we're really looking forward. We have a great group. We always have a great group. We have a great group of individuals that we'll be honoring in September. The gala, the Role Model Gala, will be taking place the evening of Saturday, September 17th in the Empire Ballroom at the Hyatt Regency, New Orleans. And people can visit our website, ylcnola.org, to find out more information. This YLC celebrates its 30th anniversary this year, which is an incredible milestone for our organization. The length of time and the impact that we have been able to have is a true testament to the leaders that started the organization and then have continued to help it grow throughout the years. It's a very exciting time at the organization, and for me as the executive director to really step back and reflect on some of our major milestones, like putting the lights on the Crescent City Connection, the Festival of Fens, the streetcar art exhibits, and some of those smaller or equally as big but maybe less visible impacts, like bringing back Recreate after Hurricane Katrina, and the hundreds upon thousands of kids that we've coached and mentored through YLC Kicks and many of our other programs. Well, I think first and foremost, financial support is an incredible way if you don't have time to be able to give what is needed to move the projects forward. We are able to run our programs in our organization on a smaller budget because of the volunteer time that is put in. At the end of the day, though, it still takes dollars to run those programs and help them be effective. So that is one way. Another way, if you may have limited time, is to come learn more about the organization and speak about YLC to your colleagues and friends and family and help identify individuals that may be able to give their time. We also have every other month leadership luncheons that our membership committee organizes, where young professionals can come together over lunch, meet other young professionals, and hear from a leader in the community about how they came into their position, how they've grown in their role. I think that's an opportunity just to take an hour and a half out of your day every other month, and that's a way to get involved as well.
Hello, I'm Todd from New Orleans. I was reading a survey that said 3/4 of the people questioned believe that hospitals and medical research facilities will be an important part of the future of the economy of both New Orleans and the state of Louisiana. What do you think about that outlook?
I do believe New Orleans is an exciting opportunity there. I'm not sure about the rest of Louisiana, to be honest. To do that, you're going to have certain few ingredients. And the number one ingredient is a really high quality academic medical schools, Tulane and LSU. And it's really important to understand that that gives us an opportunity for research. It gives an opportunity for clinical trials and developing new procedures in order to take care of healthcare. It gives us the ability to really develop something that can be a leading edge economic edge, a la Houston and MD Anderson, a la Johns Hopkins in Baltimore, a la the Mayo Clinic in New York. I think we have the ingredients. I don't think we got them anywhere else in Louisiana, to be honest. But I do believe the big thing about medical care is that the baby boomers are aging. And as the baby boomers age, their medical needs go up tremendously, and that's, I think, a part of this process. But baby boomers are everywhere. So what you have to have is the differentiating factors. And to me, that's a really first-class medical school and medical education programs that can drive people to come into you because of the research and development that goes on. I think we've got that organized well. I think it's consolidated into medical corridor now. I think the major investment we made there, helped with FEMA funding from the federal government, is going to do super. And I really believe that there is an opportunity to create that as a major part of our economy. The big negative is that most of the reimbursement comes from the feds nowadays, and that's a tough thing to do because they've got huge budget deficits, and over time they've got to cut those amounts they pay for those services. So it's good. That's the tricky part, but that affects everybody. Whether you're the best or you're the worst, you all have to deal with the fact that the feds are going to be cutting reimbursement.
That's what people out there can ask Ashton Ryan, our local community leader, any question involving business, and he'll get back to you. Of course, you can write him by going to our Facebook page and going to Ed Marshall, Money Talks with Ed Marshall, that is, at the Facebook page, and he'll get back to you. Well, that's going to do it for our show for this month. Until next time, remember, it's your money. Make it work for you. Until next time, do something good for yourself. Do something good for someone else. I'm Ed Marshall, and we'll see you.